Today's guest is tackling one of the most silent but deadly health challenges we face: cardiovascular disease. Emily Elst leads the Australian rollout of CardiAction Screening Australia, a simple, non invasive screening program that partners with local pharmacies to give people real insights into their heart and artery health. After years of success in New Zealand, Emily and her team are bringing this life saving innovation to Australia, helping communities detect risks early, prevent hospital visits, and empower everyday people with knowledge they've never had access to before. We'll talk about why this work matters, how pharmacies are becoming unexpected hubs, and what's next for preventative health screening. Emily, welcome.
Hi, how you doing?
Good, good. Good to have you here. So, for listeners who are new to you, what is cardiac action screening and what problem are you solving in Australia right now?
Well, heart disease is one of the leading causes of death in Australia and globally. Here in Australia, one person dies every 12 minutes from some kind of cardiovascular disease. And shockingly, around half of the people who end up in hospital after a cardiac event are unaware of their risk. CardiAction Screening is a simple, non invasive screening service that helps to detect that risk early. We're looking at the heart and the arteries, the pump and the pipes, if you will. We're checking things like central systolic pressure at the heart, and we're looking for signs of arterial inflammation and stiffness, which are all key indicators of potential heart attack or stroke. So our screenings provide instant results, personalised lifestyle recommendations to try and empower people to take proactive steps that are relevant to them. And the most exciting part is that around 80% of cardiovascular disease is preventable. So these sorts of early insights can literally save lives.
Well, those numbers are scary every, what'd you say again? And for every
Every
12 minutes?
12 minutes, it's
Whew,
kind
man.
of insane.
Yeah, that is scary. So what first sparked your interest in tackling?
Well, I've always been drawn to personalized and preventative health. I do really love modern medicine. I'm very grateful to live in the age of antibiotics, but I also recognize its limitations. So, waiting for symptoms can often mean that it's too late, and large population averages don't always address the unique needs of individuals. So, by giving people information about their heart and arteries now, we can guide them to action before problems arise. The National Hypertension Task Force and other World Health studies show that this kind of preventative action is really key to reducing cardiovascular disease. And so, for me, being part of delivering that change and empowering people with knowledge is highly motivating.
Is key, right?
Yeah,
So
absolutely.
let's break it down simply. So walk us through how does the screening actually work?
Well, booking is easy. People schedule a 20-minute appointment online at their local participating pharmacy. One of our friendly screeners fits a blood pressure cuff and takes a reading using a machine, which does feel similar to a standard blood pressure check, but it also performs what's called a pulse wave analysis to capture additional measures and data that we can then use. So the CardiAction system analyzes those readings along with other key biometrics, and it gives more or less instant results that indicate the stiffness or inflammation in their arteries, what their central systolic pressure is looking like, and a bit of a view of their heart efficiency as well. So the screener goes through those results. They then walk that person through ideally 1 to 2 actionable steps that they can take from that outcome. And if needed, they may also provide them a letter for their GP. And then post-appointment, a detailed report and all of those lifestyle recommendations based on their level of risk are emailed to the participant. So the screening gives people a rare opportunity to see their arteries and heart health before symptoms appear, which is normally only possible with more invasive or expensive tests.
So just to be clear, no needles, right? This is not like a blood
No
test.
needles, no
No needles.
needles, no radiation, no running on a treadmill. It's really quite simple and straightforward, very
Okay.
non-invasive.
And how accurate is it? And how has it been validated?
CardiAction screening is highly accurate for assessing the hemodynamic system, which is essentially how blood flows through the heart and arteries. So, both the pulse wave analysis device and the CardiAction algorithms have been validated through years of research and clinical use in New Zealand. The CardiAction pulse wave analysis device is also both TGA and FDA approved, and additional validation testing has been done to compare its outputs to invasive cardiac catheterization with about 95% confidence in comparable results. It is really important, though, to clarify that it is a risk screening, it's not a clinical diagnosis. So, what we're doing is providing insights about the heart and artery health. We're focusing on arterial stiffness and inflammation and helping people to understand their risk level and giving them some actionable, tailored interventions to reduce their risk of having a heart attack or stroke.
So talk about that report. What exactly does the report tell people and what doesn't it tell?
Yeah, sure. So the report focuses on a range of key measures. That includes central systolic pressure, which is the blood pressure actually at the heart, not just the arm. We look at augmentation pressure, which is related to the flexibility and inflammation in the arteries, as well as the aortic health, health of the large artery, heart efficiency, and heart muscle reoxygenation. So each of those measures is then presented with a healthy target range. And based on their results, the participants are placed in a risk cohort, which has tailored lifestyle recommendations based on their level of risk and where their results have landed on that day. And some people will also receive a GP letter for recommended follow-up if their results indicate that might be required. So the report doesn't diagnose a specific disease, but it does give early insights into risk, which gives people the opportunity to take proactive steps before serious events occur.
Okay. Who do you see as the primary audience? Is it
Mhm.
age or lifestyle or family history that matters most?
Really, any adult can benefit. If you have a heart and arteries, this is probably a good thing for you to look at. But typically, we see more people aged in the 40 to 75-year-old bracket, as that's when risk is known to increase. And people are often motivated when they notice friends or family affected by heart disease as well. Lifestyle is important too, but hidden cardiovascular disease can occur even in those who appear fit and healthy. And of course, family history is a strong factor, but awareness and proactive monitoring can change outcomes. You don't necessarily have to follow the steps that your family has gone through before. So, screening gives everyone a chance to manage their risk before it manifests as a major event.
Don't wait.
Don't
That's all I can
wait.
say.
Absolutely. The more you know about what your body's doing, the more opportunity you have to fix it.
Catch it, try to catch it early. So, for someone on the fence, how do you frame why an early risk indicator matters?
Well, every body is unique and lifestyle impacts risk differently for each person. So, if you know your current risks, that gives you actionable information about what you personally need to focus on right now. Knowledge empowers action. So, enabling even just small targeted changes that have a great benefit is really important. And it's just about taking control of your health before symptoms appear.
And I know that you touched on this a little bit before about when they book and whatnot, but can you walk us through what happens? Say they've booked the appointment when they walk into the pharmacy from that booking the results. Can you walk us again through that?
Yeah, absolutely. So it is really easy. They book online, they arrive at the pharmacy, and they meet the trained screener in a private space. The screener will explain the process. They fit a blood pressure cuff on their arm, and everybody just sits quietly for a few minutes while we capture the pulse wave data for the CardiAction system. Once that part is done, the results are available almost immediately. So the screener will talk through what those results mean, how that person has measured today against the target ranges. And based on any indications of risk in their results, the screener will also talk about some things they can do to improve that risk. Ideally, giving them just a couple of focus areas to start with. And then participants leave with their personal report with all the details about the results and what they mean, lifestyle recommendations specific to them, and if necessary, a letter for their GP. So the whole process is simple, it's fast, it's actionable, and it takes up to 15 or 20 minutes of their time.
How do you share results that, I guess, like without overwhelming people? Like maybe they're not so good. So, like, how do you break the news?
Yeah. I think it's important to focus on what people can do, not just the risk, but actually what they can do walking out of that appointment to improve things for themselves. So even if the results show a higher risk, participants now have information that they didn't have before and a clear pathway to action. So the discussion is ideally supportive, really emphasizing manageable steps and next actions, which might be lifestyle changes or they might be going to see a GP for a consultation. But the goal is that we want people to leave being informed about what's happening in their own system, but also empowered about what they can do. So we don't want people walking out anxious. We do
Sure.
want them walking out with next steps for themselves.
Do you have a story anonymized of someone who walked away making a real change after their screening?
Yeah, probably lots of stories. There is one case from New Zealand. There was a gentleman who came in feeling perfectly healthy. I'm pretty sure his partner may have encouraged him to have the appointment, but the screening showed some high risk indicators. So he followed up with his GP and discovered some serious underlying issues, and he was at serious risk of a major cardiac event. So that screening quite literally helped him take action before something life-threatening happened. And it's stories like that that remind us why early detection matters. They happen frequently enough to show the impact of this kind of proactive screening.
Ah, love it, love it.
Mm.
So from the pharmacy side, what's the real value in offering screen?
Well, for pharmacies, it's part of them becoming true health hubs, offering services beyond just dispensing medications. So, screenings build community trust, patient engagement, and they demonstrate that the pharmacy has a real commitment to proactive health. The pharmacies are one of the most accessible health touchpoints we have. People visit their pharmacist more often than their doctor, and they generally feel comfortable there. So, for someone who perhaps avoids checkups or feels a bit anxious in a GP clinic setting, the pharmacy can be much more approachable. So, it also helps pharmacies add value for their clients without overloading their staff because we have a trained team who handles the service, looks after the screening and the appointments and everything around that. So, ideally, it's an easy way for them to offer this kind of proactive health in their community.
And it kind of makes me think, sometimes when you go, well, I think often if you go to the pharmacy and I don't know if there's ever a time where you just pick it up right away and you're on your way. I feel like even when I've picked stuff up for my folks, it's it's go there and then they start to get it ready. They tell you it's ready, but then when you get there, it's like,
Yeah.
no, wait another 20 minutes. So I wonder even if you could combo it up, with an appointment like this and kill some of that time as well and take some of the
Absolutely.
burden. Yeah.
Yeah, absolutely. Drop your script off and then go and have your screening and walk out with everything.
Yeah. Yeah. Or at least let them know, like, hey, I'm here to pick it up and it's okay that if it takes 20 minutes because you're
Yeah.
getting a screening. So if a pharmacy group has multiple locations, how do you recommend they roll this out?
Well, we work with the managers at each locations to schedule clinics in a way that's going to maximize access for participants. So for nearby locations, we might stagger the days, or for larger regions, we can offer simultaneous clinics. It's about being flexible and designing it to reach the most people efficiently.
And then you've just started hiring screeners in Australia. What makes a great screener?
That's a really good question. A great screener has a combination of practical skills and personal qualities. So they need to have empathy, excellent communication skills, good health literacy, so they can clearly explain results and guide people through the process. They also really need to have a genuine interest in preventative health and a real desire to make a difference in people's lives, because much of this work is about empowering individuals to take control of their heart and artery health. And many of our screeners do have their own personal stories about why early detection and prevention is so important to them. And that really adds authenticity and care to every screening appointment. We do provide comprehensive training and hands-on experience, but that underlying passion is what truly makes someone excel in this role.
Just being human and being, And
Yeah.
yeah, no, I like that. What are the most okay? Because so talking about prevention and lifestyle, what are the most common, say, flags that show up in reports?
Yeah, we do find some people with normal blood pressure, brachial blood pressure, do still have elevated central blood pressure, which is a stronger risk predictor. Or they may have stiffness or inflammation developing in their arteries, which is silent. You don't know that that's happening, but it's very likely to cause problems. So, one of the other things we also do see, unfortunately, is more signs of early vascular aging in younger adults, which is just from lifestyle factors and the way that we live in the Western world these days. But if you can catch those changes early, it's really critical to preventing catastrophic cardiovascular events down the line.
What are maybe some simple changes people can make that to say move the needle to actually try to
Sure.
improve?
So, the most obvious things are going to be nutrition, exercise, and lifestyle choices, which are the biggest contributors. And that goes for people who have a family history and maybe a genetic predisposition as well. Those things can still impact their outcomes. So things like quitting smoking, moderating alcohol, eating more vegetables and fish, increasing movement, managing stress, and prioritizing sleep are all really
Sleep.
impactful. Yeah, for sure. So typically, I'd suggest people choose one or two things from their recommendations that they believe they can consistently introduce into their current routine and focus on that. After a month or two, when that thing is easy, then add in something else. The goal is really to make those changes stick for the long term. And even small, sustainable changes can significantly reduce cardiovascular risk over time.
I like that you said, kind of doing one thing at a time. It's like, I mean, even
Yeah,
diet and exercise, like if you can do that, do those simultaneously. But, just to try to not overwhelm yourself where that you end up quitting or you're just like, I can't do this. But having those
absolutely.
gradual events, because it is a lifestyle, right? And it's looking
Yeah,
at what is it that you've been doing, what you've been doing or not, or not doing.
yeah,
And do you need to do more of that or less, right? Like, do you need to exercise more? Do you
exactly.
need to eat better? So it's like maybe cut out fried food, like
Yeah.
like reduce
And that's
first,
quite
right?
important for the way we talk about the recommendations is really breaking those things down into manageable steps. And when you've got the results from your screening, you can focus on the things that are going to have the most impact for you. What's going to be the most impactful change right now? You don't need to change everything at once. And if you
Mm.
try to change everything at once, you're much less likely to do any of it. So it's really taking that personalized data from the CardiAction screening to show which actions matter most right now and making those lifestyle improvements achievable and sustainable. And then once that change becomes routine, the next step can be introduced.
So say they get the test, say the numbers are unfavorable and
Mhm.
they go to the GP. Are you recommending that they come back and do this test again in like 3 months, 6 months? Or or even, whether
Ye-
wherever however the numbers come out, right? Like how often should you continue doing this?
It's really going to depend on the level of risk. So, for someone who has relatively low risk, their arteries aren't showing signs of significant stiffness or inflammation, their heart is comfortable with the amount of work that it's doing, those people might just want to check in maybe once a year to make sure nothing is shifting or moving as life changes for them. For people who perhaps have a higher risk, and want to bring that down, then checking more often, maybe at the 3 month or 6 month mark, is more valuable. Because one of the other great things about the CardiAction screening is you can actually see the impact of your change. So if you've gone and done something, whether it be something you're doing with your GP or something that you're doing just in your lifestyle changes, you can actually see that that's working for you, that you're on the right track, that you're doing the right things in the right volume.
Yeah.
Example of that, one of my screeners actually came to us as a client initially and had a screening, and it was really impactful for her. She then became a screener because she was really passionate about what we were doing, and she had applied those lifestyle changes that we talked about in her screening really consistently from the day she got the results. And she got her test just 6 weeks later. She redid her screening just to see if anything had moved. And she'd
Yeah, she's
actually
on the right.
moved into a completely different risk category. And
Oh, that's great.
it was really reinforcing for her that she was doing the right things, that it was making a difference, that her family history didn't define
Who
the
she, yeah,
direction she was going in, keep doing these things and keep her risk low. So I think being able to check back in is
yeah.
also really
It's
powerful.
not gonna hurt. Yeah, to see,
That,
especially when you're purposely, right, trying making these changes and you wanna see, like, is it making a
yes.
difference? And am I on the
And
right path?
cardiovascular health changes over time. It's impacted by so many different things in your lifestyle. So, as you age, as you change how you're eating or moving or whatever's going on in your life, it's just good to check in and see how that's working.
Okay. How do you see pharmacy-based screening fitting into, say, the broader healthcare system?
I think it's is definitely a complementary thing. So it's not that pharmacies are ever going to replace GPs or hospitals or anything like that. It's about how all these things work together. And because pharmacies are so accessible and people can easily pop down to their pharmacy when they're not well or something's going on, if they're able to offer more comprehensive services in the pharmacy, more proactive health services to their clients, that has the potential to take pressure off our GPs who are definitely under a lot of pressure, and also our hospital systems when we're talking about things like cardiovascular health. When you have these kind of issues developing silently over time, quite often the first thing that happens is you land in hospital if you're lucky. So if we can help support pharmacies to offer a few more of these comprehensive health services, then that's really supportive of the whole medical system that we're
Yeah.
providing to people. And it doesn't mean people are not going to need, like, they absolutely are going to need to see their GP. For some things, they are absolutely going to need to go to hospital and they need to go to hospital. And it's great to have those services there. But when they're really overloaded with things that perhaps could be managed earlier in other
Mhm.
ways, that makes it hard when we do have those really critical situations.
It's really thinking about that longevity and prevention and potentially,
Oh,
like, what if I could keep myself out of the hospital or longer, and
yeah.
then going back to what could that really do to help the hospitals? Okay.
Yeah,
So
definitely.
if you have one message for Australians listening right now, what action do you most want them to take?
Don't wait. Book your CardiAction screening appointment today. If we're not at a pharmacy near you, contact us to get on the waiting list. We'll be there soon. It's 20 minutes that could save your life, giving you insights and actionable steps to reduce your cardiovascular risk. So at the end of the day, knowledge empowers action and action saves lives. That's that.
That's it. Yeah. Where can listeners learn more and how can pharmacists or partners connect with you?
Probably our website is the best place
Okay.
to start. So visit cardiactionscreening.com.au to get more information. You'll find participating pharmacies there. You can book in a screening and also explore partnership opportunities. Pharmacists and healthcare partners can contact us directly to talk about what that might look like. And people can book in or let us know if they don't have something local to book in, and we'll endeavour to get there as soon as we can.
Wonderful. Okay. So, final word. Why is preventing heart disease in Australia today more urgent?
Cardiovascular disease is largely preventable, yet it remains a leading cause of death in Australia, in fact, around most of the world. So, this kind of early detection and personalised guidance can literally save lives. CardiAction screening is a simple, non invasive check that gives you real insights into your heart and artery health. It's for every adult, whatever your age, however healthy you think you are or not. Take control of your heart health. Do something proactive for your life today. You just find a participating pharmacy, book a screening. It's 20 minutes that could change your life. And when you understand your risk and take steps to reduce it, you're making a real difference for your heart and arteries.
Emily,
Not
this has been great. Thank you. Thank you so much.
No problem. Thanks for having me.
Thanks for tuning in to this episode of The Wellness Grow Show. If today's conversation sparked something for you, hit subscribe so you don't miss the stories, strategies, and insights from the front lines of wellness innovation. If you're a founder, operator, or health leader exploring growth into institutional markets and have a story worth telling, I'd love to hear from you. Reach out directly on LinkedIn or YouTube. And if you found this valuable, share it with a peer or post it online. You never know who needs to hear it. Until next time, stay well, keep moving, and keep building what matters.